I actually did quit my fellowship. I've not had a post go viral in a while, so here goes nothing. This is not something that I've divulged to the internet world yet. Some of my close friends and colleagues know more of the detailed story behind everything, but I did quit my fellowship before it ended for a multitude of reasons. Primarily lack of education, lack of teaching, essentially, hostile work environment. I got to the point in my fellowship when I felt like I really wasn't learning anything new from day to day, and I felt like the environment was not conducive really to anyone working there and tolerating the treatment that I was tolerating. A really, really hard decision. And a lot of times people will say, well, why didn't you just finish out the last couple months? And I think that our own experiences very much dictate our line in the sand for what we will tolerate. I had experienced enough mistreatment and abuse prior to that I had a pretty firm stance on what I would tolerate from other human beings. And I will say, I don't think it's just my medical and surgical training that informed me of what I would and wouldn't tolerate. I was a former gymnast, and I think any competitive athlete will attest to the fact that there are really difficult coaches. And there's just such a fine line between a good coach who pushes their athlete to be their best and then a coach that abuses their athletes. I was never abused, I don't think, in my own opinion, subjectively when it comes to that topic with gymnastics, but I had friends who did sustain emotional, physical, verbal abuse during their time as a gymnast. The reason I've been so hesitant to talk about my fellowship is one, reputation. I think it's odd for a doctor to admit that they quit something during their training path. Rather than 6 full years of surgical training, 5 years of residency and a year of fellowship, I essentially had 5 3/4 of a year. I quit just 2 months shy of finishing my 12-month fellowship. So as a new surgeon, a new business owner, I didn't want me quitting to have a negative impact on my reputation in my community among potential patients. I think at this point, I've proven myself reputation-wise, patient care-wise. You know, we're not a brand new practice. Patients now have a sense of who we are and what we do, and I have more before and afters and more reviews of our practice. The other reason I've been reticent to share information about my fellowship is fear of litigation from the other party. I think litigation is very common, particularly in our country, and I don't want to say anything that will get me in the mud. That being said, we are far enough out of the whole thing that I do feel comfortable talking more about it. The extent to which I talk about it, I'm still not sure about. It's something I think about a lot. I also think me sharing my story is helpful for other students, whether they're med students, nursing students, surgical residents. Other prospective fellows within my field of facial plastic surgery have reached out to me and told me that they are experiencing similar things in their environment and have asked me about the board certification process and all of the nitty-gritty that goes along with making such a big decision. But I think the further I get out from it, you know, it's been 2.5 years, the more confident I am that I made the right decision for me.